your team has the opportunity to move forward and work with them in advance of next summer? Does this give you that?
You know, we've had meetings with Jeff Golden, who's the associate VP of auxiliary services. So we think we have a working relations set up to avoid any issues for the upcoming camp.
Okay.
So I mean, there's really no issues. Yeah.
Okay, sorry.
Feel like
Most
I
of
can
the
vote
time
on it,
we're
but I'm
glad
glad
to
to
have
have
you
you.
affiliated. So it's
sorry. Okay, so moving along then, let's go to Love Kitchen, which is the next one. So if I could get a motion to approve as written, but first from Samara. Second from Melissa. Let me turn it over first to Skip. Is there anything that's not in here that you want to talk about? It's not clear. Okay, let me open it then to board members with any questions about it. Just make sure. That's ready. No, it's okay. So I just want to make sure you're ready. Are you ready?
Yeah.
Okay. Any discussion from you or questions, Ed?
No.
Okay, so all in favor is written. If anyone opposed, okay, that's unanimous. That was unanimous. We're on Love Kitchen. That was kitchen unanimous as written. John Joseph Inn is next. Did we heard it? What? Oh, sorry. Can I get a motion to approve as written? First from Samara, second, from Clay. Anything from you?
The only thing I'm gonna add to that is you can expect at some point that they're gonna be coming back to the board because they're currently operating without a permit as well. We've just been having issues with communication with the operator. So just making you aware of that.
Yeah, this one I just had, I think this one is the one I did have a question on. I think it was the communication question, because there were just a lot of like. Okay, I think my question on this one was that it looks like there's been an issue since 2024, right? So then we issued them a temporary permit. Then they got a violation. But so they've been continuing to operate since 2024 without a permit?
Now, I think that in 2024, we didn't issue a permit because we were waiting on insurance.
Right.
Insurance came through. I believe the permit was issued at that point. However, we're having the same issue this year, so we're not issuing the permit, a temporary permit.
Okay.
His feet to the fire on me.
What, say that one more time?
Hold his feet to the fire and not issue the permit.
Okay, I think that was my question, was that we're not continuing to issue permits, right, without. Okay. Any other questions on this one? See. Okay, all in favor is written. And that's unanimous. I'm not going to leave mine on my glasses on.
Yeah.
All right. Okay, go back to normal. Welcome. We'll let to get settled here. And then I'm gonna recuse myself from the first one, so can you run it? But let's do one more and then we'll go back to number one. I did loud. Okay, we're on enforcement actions and we are on Fall Creek House. We're gonna do Fall Creek House and then we're gonna go back to the first one, okay? Okay, so Fall Creek House, a motion to approve as written. First from Dr. K.
Dr. K.
Second, oh, this, I'm gonna separate. First from Ed, second from Frank. Skip, anything to add to this one?
No, it's pretty straightforward. We had spoiled food on 2 occasions, which are critical.
Any other questions for board members on this one? Questions? All right, all in favor as written? Anyone opposed? Did you vote? Which one you're voting?
That's right.
Approve, okay, so we're unanimous on that one. So I'm gonna step out of this next one and turn it over to Melissa. I call you Dr. D, but I'm afraid there's another Dr. D in the room.
We can figure it out. We can figure it out.
Dr. Daniele, so you'll have quorum without me.
Can I start with
Yeah,
that?
yeah, go ahead.
Okay, so now we're moving to the Suzuki, operating without a permit. Can I get a motion to accept it as written, approve as written? It's first from Dr. K, Ed, and a second from Laura. If anything that,
They were, Ithaca Suzuki was operated by the college last summer. They were going through the permit approval process. They weren't able to meet all the requirements. So we weren't able to issue a permit. They ended up operating the children's camp. So they were operating without a permit. Subsequent to that, we issued the stipulation agreement a while ago, but we've had meetings with representatives from Ithaca College. I think it was good. I think we had good communication there, commitment on their end to work with us to avoid any issues this upcoming season. So, yeah, I think we're in a good spot.
okay, any questions from the board? Okay, can we vote to accept it as written? All in favor? All in favor? Unanimous?
Yeah.
Okay, thank you. We'll get back to you.
Okay. Okay, so let's move on to Newfield Estates. Make sure everyone can kind of get there. So if I could get a motion to approve this written. First from Frank. Second from Flora. Okay,
Yeah, so this has been a really challenging situation for us. So they continue to operate mobile home park without a permit. It's not a great situation and because the owner of the park is very sick. His daughter has been trying to assist, but again, we're running into these communication issues where they're not getting back to us. She did reach out via email yesterday, said that she had the flu, and of course her dad is sick. She did make mention of an aunt who might be coming back into town to assist, but currently we haven't received the full application, the fees, or the insurance to be able to issue a permit. So there was it's a violation of Board of Health orders because this is the second time they're coming back for operating without a permit. They do have a water system operator, so we are, keeping tabs on the water end of things just to make sure there's no issues there. But it is concerning to us that they don't really have a viable, responsible operator that responds to us timely manner.
okay, I just have, go ahead, Frank. I have questions about what fines we're actually levying because I was getting a little bit confused. So when I start with the letter says we're not renewing your operating permit, including payment of the $400 penalty fee, renewal application that was due on that, and it refers to these orders. Okay, but then there's this order, the 026 order. So this order though, that says, on the back of it says it's the 512 for the completed renewal application, plus a penalty of $1,900. And then 0013, which is the next one, is the 400, it has a $400 payment and then a $275 payment in there. So I think I just want to make sure we're being clear in the letter, like what is it that they owe you?
Yeah, so they owe us the 512 for the permit application. And then it would be the 1,900 because that includes the current violations in this resolution and for the unpaid penalty from resolution 0013. So that includes the 400. So for these violations, it's 1,500 plus the 400.
Okay, so I just think the letter is a little confusing personally, so I'm wondering if in the second paragraph where it's referring to the copy of the draft resolution, that we actually put the number in there, ENF 25-0026.
Okay.
Because we're referencing, hold on. So if I read this, I would say, as you've complained, okay, with board. You shouldn't have, okay, $400. So do they owe the $275 for the annual water fee? From
In
0013?
that resolution, it says completed, so they paid that.
Okay, so they did complete it. Okay, great. Okay, sorry, thank you. Sorry.
Just $400.
So it's just 400 from this one, but then we're on top of that levying another 1,900 and 512.
Nope, it's 400 for the previous resolution,
Right.
and 1,500 for this resolution. So that 1,900 includes the 400 from the previous resolution.
So I understand now. Okay.
I can break that out if it's.
I think it's confusing what's owed, like when you're trying to track all of this, because if I read up here, it says completing the payment of the $400 fee. But the $400 fee is included, I see, in the 1,900 in here, plus five. I don't know, maybe it's just me. I find
No,
it-
it's confusing.
I think it's confusing what's owed, and I'm worried that there's gonna be double payment because it's not clear. So,
Yeah, so what I can do is in the cover letter that goes out with the final resolution, I can break that down in the cover letter. Right, so what's owed is the permit application, I can spell that out,
right,
512. The prior penalty from resolution 0013, which is 400, and the current resolution that is 0026, which is 1,500.
okay.
Is there, Skip, are there different deadlines affiliated with those that would be worth including, especially if they are not able to come up with that total sum at once? Is there like a priority payment plan that you would recommend or be able to spell out for them?
Yeah, we always offer the option if they reach out to us and say, hey, we can't
Then.
make the full
Yes,
payment
exactly.
by, in this case, it would be, so for the application fee, the deadline we put in there is February 6th. And then for the penalties for both resolutions, the 1,900, we put in March 15th, which is pretty standard for resolutions, the 15th of the second month. So if they were to come back to us and say, hey, this is a lot of money, we would offer them a payment plan.
Okay.
Break it down by month over the course of a year.
Can you say that in the letter?
Yeah.
Okay, I think that would be helpful.
And then I also guess I'm wondering if number 3 in the current resolution, is it appropriate that we're combining the fee from the last resolution with the current fee for this resolution? Or should those be two separate numbers? Like number 3 should be payment of the unpaid penalty fee from this resolution of $400 and then payment of a $1,500 fee. And the $1,500 fee is related to what? Why are we levying that one?
Violation of Board of Health orders and the continued operation without a permit.
Okay. Because it seems like those are two different fees, right?
They are.
So-
So I can, so if you want, we can modify the resolution and I can break that out. So you pay the $400 from resolution 0013. I think I keep the due date the same, so it's past due is March 15th. And then pay a penalty for the current violation of Board of Health orders and continued operation without a permit of $15 through March 15th. Something like that.
I think
And
it would be cleaner and clearer
sure,
that this is, there's things that are in here because they haven't been paid, and then there's a new thing that is being levied because of whatever. Because then we also have in the current one that if they continue to operate, that we can seek penalties up to $2,000 per day. So I think it's important that we're sort of tracking what they're paying. It's clear when it's being levied when.
yeah, understood.
Hey, Skip, the other thing maybe to include in your letter, and I know this to be true about your staff, but they might not know this, especially if it's not a new park owner, is that like, I would guess you guys are willing to go sit down with them and help them go through the application, fill out what they need. You know, like she might not know that like we are also a helping hand. We are not just an adversarial body. So it might be worth trying to say that. Not that you haven't already, maybe you.
Yeah, we've done a lot. We've done a lot of.
Okay.
outreach. I mean, we were, it's just an awful situation to
Yeah.
start with, but they keep telling us things and not following through. And it's just getting to the point where it's uncomfortable.
Okay. All right. Yep, I hear you.
Okay, so do you need to revise this and bring it back to us, or should we vote on it with a sort of a friendly amendment to this about the revisions that we talked about?
I think sort of noting that those changes are gonna be made is fine. And that'll be in the, in the minutes.
Okay, so let's do this in two steps. Yeah, oh, I'm sorry, please.
Skip, how many strikes and you're out and what might out look like?
Yeah, so, it's not really, we've been down this road before with mobile home parks, right? It's not like we can go in there in the back of the mobile home park with, I'm not even sure how many, 80 sites. So, yeah, it's one of those things that we have to kind of work through it. They may come back to the Board of Health and keep incurring penalties. It's a tricky situation.
I mean, if penalties, keep accruing, it might get, well, I'm assuming you get to a point where it's not manageable. What happened?
Yeah, I mean, they would,
Would it fall on each individual home?
I think it would get to the situation where eventually they would have to probably sell the park. In terms of fees that we have assessed, we can always put a lien on the property to recover those fees. But from our standpoint, the fees are not intended to, cripple the operator. We want to work with them to get them back into compliance. But it's a difficult situation with mobile home parks because, there's a lot of families and homes in the park. And, to close down a park is.
No, I'm. But if they sell, does the new owner assume the responsibility for the previous fine?
Would assume responsibility for bringing the park into compliance.
At this point, it's just obtaining a permit. Everything else.
They would have to get a permit. They'd have to come and get a permit. They'd be
Yeah.
expected to, yeah.
Yeah, I mean, really, that's the only issue. We're keeping tabs on the water. We're not aware of any like failed sewage or other issues in the park. So there's no, at least that we're aware of at this point, there's no public health hazards that exist. They're just operating without a permit.
Okay, so this is what I'd like to do. We're gonna vote on it as written. I'm not telling you how to vote. But I am gonna introduce a second motion with edits that we requested to vote on, okay? All right, so all in favor of approving this as written? We have one
Oh, as with the 15.
as written right now.
Oh, not with that. Sorry.
I'm not telling you how to vote.
I'm sorry. No.
But
I didn't do that. Oh, sorry. My bad.
All opposed?
Dr. Kiggy then.
Okay, all right. Okay, I'd like to propose a motion to approve, this is a motion to approve the fines as proposed in front of us. However, with a revision to the letter to make it more, the revision to the cover letter and a revision to ENF 25-0026 to make it more clear what the fines are that are carrying forward from the previous resolution versus what the fines are that are being levied with the current resolution. And that the due dates are also clear for each of those different items, okay? Can I get a second on that motion? I have a second. I'm sorry. Okay, well, I'll take a first and a second from the two doctors. Well, sorry, two of the four. Not about that. Okay, any discussion on that? Okay, all in favor? Oh, and that's, okay, great. Okay. All right, let's move on to Prosper's. Okay, a motion to approve is written. First from Ed. And from Frank. Skip, anything to add to this one?
No, it's pretty basic. Food, it was food out of temperature. We did include, trash management in the resolution just because we've been citing it multiple times. It's not considered a critical violation, so we did not include a penalty for that, but it kind of sets the stage. Should they not clean up their act on the garbage handling, that we include enforcement in the future.
Great. Questions on this one?
The footnote, he has the Ithaca Suzuki Institute. I think when they were drafting the resolution.
Yeah, the bottom.
Oh,
Oh,
yeah, good catch. Okay, so need an edit to their footnote at the bottom.
I don't know. I think
That seems to go on.
I don't think that's our document. I think that's part of the packet.
Oh, the packet.
Space look okay, Fall Creek cows look okay.
Yeah.
So it might be this one. Alright.
No, it carries, oh, no, it just, yes, one,
Yeah,
yes,
yeah.
It goes on the inspection reports too, so it's not something we added.
so it's just related to what the board packet looks like, it's not an actual. So no edit needed that on what.
But I'll double check.
No, just-
But it does say like on the dorm hotel on the next one, it says the dorm hotel in the footnote.
You're saying that's not what goes to the before.
Yeah.
Okay. Yes. Stop misusing those. I'm just gonna in these contexts. Okay, all in favor? And I think we're unanimous. Okay. Next one is dorm hotel, and dorm hotel is the one that we do have a letter. So just make sure you've got that. But let's start with, motion to approve this written. We have a first from Frank. And a second from Samara this time. All right, Skip, anything to add to this?
No, just that it was related to emergency exit lighting. We went back to do 2 re-inspections and, they did correct 2 lights and then there was still 1 light that was still out. And normally the dorm has a history of good compliance. So I don't know. Looks like they're claiming that they had a water leak that caused an issue in the ladder.
Okay, any questions from board members? That one? Okay, all in favor is written.
I have a question, just the number one, pay penalty by March 15, 2024.
Sorry about that.
Thank God you're here today.
I know, right? I did not catch that.
Earning our salary.
Yeah.
Yes.
Good. Okay, so we're voting on this one now. This one, we're asking for the change to the date to be 2026, right? Anything else on this? Okay, all in favor with the change to the date? Okay. Then we've got another mobile home park, which is Hanshaw Village. Just make sure. Okay, so let's put this first under a motion to approve this written first from Melissa. Second from Samara. All right, Skip.
Yeah, so this has been an ongoing issue at Hanshaw Village. Part of it is related to, occasionally you're gonna get stuff caught in the sewer lines and you're gonna have overflows. We addressed that last time. I think in the last resolution, part of the issue was the response time was not there to get the issue addressed. We asked them to reach out to us in the future if there were additional discharges to the ground. In this case, it was actually a pump chamber that was discharging raw sewage that was leading into a creek. They did correct it pretty quickly. However, we found out about it without notification from Hanshaw Village. And now we also are requiring them to have an engineer evaluate that pump chamber to make sure it's properly sized. And also has alarms on it to avoid future discharges.
Okay, and then on this one, I had a question to you about the payments, the violations. So they owe $500 for this time, right? Did they pay the $400 lost that was due April 15th, and did they pay the $2,500 that was due in November? Do you want to mark those completed on those? Since you have the other stuff completed that they did?
Well, so that's the old resolution. So at the time that we did that old resolution.
Okay, so this one, the only violation they're paying is the $500.
Correct.
Okay, got it.
And I guess just for the board's information, recently the town of Dryden applied for CDBG funding. And they were awarded $1.5 million. The intention for that funding is to be used for connection to municipal sewer to the park. So that's great news. However, that doesn't change the fact that they have to maintain the internal infrastructure of the park. So, it's still important that they have the infrastructure within the park working properly to prevent that, but they currently discharge to a lagoon. So they're under a consent order from the DEC to correct that. So this is all good news. And, we've been working in talks with the DEC and planning if they're going to be running municipal sewer to the park to see if there's any potential to run municipal water to the park, which would be a huge win for the residents of the park. So we're still really advocating for that. There's a prior resolution, I think it was from 2024, where they had to put together an engineering report for us for options on the water at Hanshaw Village, and they came up with three options. One option was to upgrade the treatment system, which that was gonna cost somewhere around $500,000 to do. They were also gonna explore wells at the park because the current wells are down on Lower Creek Road, which is almost 2 miles away from the park. So from EH's perspective, we're concerned if they just upgrade the treatment system and not evaluate the transmission line that's 1.5 miles away, because you still have to get water up to the park to treat it. Additionally, the wells on Lower Creek Road are prone to flooding. So we haven't really commented on the reports because we're working with Hanshaw Village to try to push them to really explore the option that we think is the best for the park, which is connection to municipal water. So we're going to continue working with the park and other partners to see if we can address that.
Questions from board members? Any? Okay, all in favor that is written. And that's unanimous. All right, good for that. We got through that. So we've got two administrative actions, so one is the, you want to talk what for the first one? Maybe aspect if they pick this stuff out or you go right in front of it.
You go right in front of him.
Okay.
So the first one is that we need to reinstate Dr. Claypack to be something official. That official thing is a 2-year position as the Tompkins County Health Department's medical director. I mean, he's been nothing but an asset and wonderful to have, and such a phenomenal advocate for Tompkins County residents in matters of public and mental health. So we're happy to put forth this resolution.
Okay, so let me go ahead and put a motion on the table, which is to approve Dr. Claypack to the 2-year position as the Tompkins County Health Department Medical Director. Can I,
Dr. Claypack agreed to.
well, hold on one second. Let's put it on your motion first. So can I get a first for that from Frank and a second from Andrea? Okay, let's go ahead and put it under discussion. So first question is, did Dr. Claypack agree?
I don't think anybody asked you that.
All right, any other questions from board members on this? Okay, Olin? Yes.
I will just say not as, I mean, I'm not a voting member, but this was a result of our survey from the New York State, our DNTC and our Alexa. We had to provide all this stuff about all of our employees, including our medical director who oversees our policies and procedures. That he's approved by the board, that he's credentialed, that he's licensed, that he, you know, there's no violations against him, no complaints, all of those things. So that's part of this whole process. That's what brought it to our attention, that it should be done automatically every 2 years. It should be on the board's schedule, but I think with the changeover in leadership and all of that.
Okay.
And COVID.
Oh, wow.
So then my question for staff is that has somebody affirmed that he's licensed and credentialed and in compliance with whatever the requirements are? Okay.
Yes, our billing team does a lot of that, and also, he just renewed his DEA and his license is on file, and so, yes.
Okay, and he meets any other criteria for the medical director that is on books. Okay. Okay. All right. Any other questions? Ready to vote? All in favor? And that's unanimous. Okay.
Thank you
Yeah.
for staying.
You know. And then the next, is this an action? That's review? It's review. Is there, you need to vote on this?
Yes, I do need your vote of approval. Well, I guess if there's any changes you want to make, and
Okay, so let's put it under a motion first and then let's open it for discussion, okay? So then I need a first, okay, we have a first from Andrea and a second from Samara to review and approve the emergency response plan. So let's maybe can you just start us off with like, what is this?
yeah, this is again a result from the survey from New York State DOH. for our, I believe this one was for our Alexa. A requirement of the Alexa is that we have a plan in place that during emergencies, we have like a client list we can quickly pull and call down that list, that we prioritize clients who might have higher needs in an emergency. We also have a staff call down list. If there's staff out in the field and there's an emergency, how do we quickly communicate with them, like stay in place or come back to the office or not? We also have to communicate with, so we're the DNTC, we're the Alexa, but we work closely with BNS because they're the certified agency in the county. So we have to provide lists to them as well.
Our Lixa oversees our Moms Plus program.
Yes.
So the actual staffing that is sitting under the Lixa is our Moms Plus.
And remind me, what does Lixa mean?
Licensed Home Care Services Agency.
Okay, thank you.
I think a lot of Lixas in the state serve elderly people.
Yeah.
So I think a lot of this emergency planning is more that population. So it's a little bit strange to do it for like generally what is a younger, healthier population, but it's still a requirement from the state that we have a written plan in place, for our clients. This also touches on, how my unit CHS communicates with other divisions during an emergency, the training we provide staff for emergencies, things like that.
Questions?
The emergency preparedness guy.
So, in my many years at Cornell, working with units to put together emergency response plans and crew plans, unit operations plans, I often found that people made references to other units, but they never let those units know that they'd be involved.
Yeah.
And, I'm wondering if, for example, ambulatory transportation, ambulance transport required. If there's something going on in the county, Bangs is likely to be overloaded. Have you reached out to them or Gadabout for transport or, reaching out to Yuga Health to do pods. I put together 2 pods at Cornell and assisted by QCMC. And so those kind of outreach to, it's one thing to have this in place, but if your partners are not aware or not part of it, then this is just a piece of paper.
So this is just my division's plan. That I believe rises to the level of like our whole health plan, which we have Ryan now, our new preparedness director, who's going through all of our sort of whole health plans at that level. So I think he would be the one, and those plans would address more of those issues. We would certainly be a part of, we've been a part of pods all along. My nurses have staffed some training pods, some actual pods. So I think, again, we're sort of like a little piece. I did work with Sam on developing this. I looped in Brenda and Jenny to ask for their review.
Frank, I had the same question to Rachel, actually, when I first got this. I said, can you tell me the scope of this plan?
Yeah.
Who is this for? Who is impacted? And so it is pretty granular to her nurses and the clients that are in the Moms Plus program.
Yeah.
But we are thinking, we do have a new public health preparedness person who's taking a look at all of our COOP plans at a departmental level. Obviously, we plug in very closely with Doer on any sort of county plans. So we are making sure that this is compatible and can roll up in the appropriate way and isn't necessarily in conflict with any of the other larger departmental preparedness plans. And Ryan, who is our new public health person, is going to be coming, I forget what meeting, maybe March, to do an overview for you all in one of our sort of deep dive focus groups on the public health preparedness work that he's been doing for the department. So there's more to come on that as well.
And this is probably like the cart ahead of the horse kind of situation. Like I did mine first because the state told me I had to as part of the plan of correction. So I just was like, all right, I got to get this plan done. But it really should fit in with all the other divisions and with the whole health.
Any other questions? Okay, ready to vote? Yes. Okay, all in favor? And that's unanimous. Okay. We will turn it over to everyone for your monthly reports to the extent that folks have more they want to share about those. Hold on a second. I'll just run through them really quick. I'm here. The rest, yeah, it's in the back. Okay. Anything for the financial summary? Is Jamie here?
No, I think we had talked about moving to having a less frequent fiscal update and just doing it more quarterly, so we don't have that today. Great.
Dr. Claypack, the other Dr. K, the newly reappointed Dr. Medical Director, and your report.
Oh, I don't have anything to add.
In addition.
I had something
Yep.
that's interesting. So I was on the policy committee for the New York State AAP, and one of their top priorities is immunizations. And so they're asking that New York State formally adopts the AAP or adds to the right now it says that ACIP are the people that are managing our immunizations, but it's asking that they AAP can be added as one of those groups that they can look to for immunization requirements with that and for schools. So that's one of the things they're doing. And yesterday, 12 of the major health organizations supported the AAP's immunization guidance as the guidance for immunizations this year instead of the ACIP guidance. So ACOG, AMA, American Family Association. So that was super interesting.
I think the current status is that the New York State Department of Health endorses the September 2025 childhood immunization schedule, which is basically the AAP is doing. Whether they'll make a formal statement that they're going to ascribe to a professional organization or not, I don't know.
I think it's an executive order by the governor. This is what I was told. And so they're asking for it to be formalized. So now it can be in law that we can.
Formalized in law.
The school mandates refer to ACIP,
Yeah, that gets,
so they need the school mandates to now refer to AAP.
So there's an executive order by the governor now, but this is to protect sort of that executive order. So the state can look to other associations.
We routinely also promote the associations on our social media and things like that. We frequently give a nod to their recommendations. That's sort of the tack that we've taken as well. But it'd be great to have something more sanctioned, I guess.
yeah, then, it's going to be an interesting discussion, won't it? Because go forward 5, 10, 15, 20 years, is it still appropriate if it's codified into law?
I think it's.
Becomes a little difficult.
Yeah, I think it's
Whether
the
they'll
other
actually do
proper other organizations you can pick from. So now, right now, it's just ACIP. So adding like a statement that says or other recognized professional organizations, something like that. I don't know exactly what it says, but it's to allow for some.
Certainly, a lot of bodies have been backing away from
Yeah.
explicit references to ACP, ECIP, CDC, and FDA, and so it's a little difficult. A little interesting.
One might have to. Just wondering if you would have to define specific one, because whoever is interpreting that might say, well, I want to go with ACP or ACIP, or I might want to go with AEP. So I don't know those
I
circumstances.
think that's what they're doing now.
Yeah.
Yeah.
Somebody that might decide to pick and choose might not relate well to the public.
Yeah.
But where the rubber really meets the road is, what standards are you going to use to say that a child can go to school? That's really where the rubber meets the road, because there are no other points except those imposed by an employer, for example, that would define what vaccinations an older person needs. If you're an adult, you can wander around being completely unvaccinated, and nobody will ding you for it. So it really is in those circumstances you get into needing a definition of what is appropriate.
Okay. Yeah, I've got a couple of updates. A few of these actually, since we didn't meet in November and December, these make reference to things that happened in October. But I just wanted to highlight, we held our ribbon cutting for the mental health clinic here at Brown Road in October. That was wonderful. We were grateful to have Congressman Josh Riley here. At that ribbon cutting and in other subsequent meetings, I've sort of been able to share a data impact report, which is in your packets. This is actually for 2024 because, as everyone knows, we live in a world of data lags. We will be looking to pull one together for 2025. But in our meeting that was going to be in December, kind of as a year, wrap up the year, I wanted to highlight some of these. So as a team, we shared over 300 social media posts. There were over 70 community events that were attended. In terms of environmental health, again, in 2024, they held 924 food inspections. They vaccinated 579 animals for rabies, and they did 131 public water supply inspections. On the immunization front, the CHS team did 233 child immunizations and 347 adults. For mental health services, there were 217 clients that received personalized recovery services. That's our PROS program. 511 youth that received mental health support, and then, over 27,000 mental health clinic appointments. For some of our family and child health work, we had over 1,300 WIC participants in the Women, Infant, and Children Nutrition Program. 132 pregnant people that were supported through pregnancy and postpartum in both our community health worker program and moms. And then in Children for Special Care Needs, 415 children birth to 5 that received some form of developmental support. So I just kind of wanted to highlight those. And even though this was, these numbers are a bit dated, I'm sure that that impact was also true for 2025 and probably even greater. The other, one other update, I was honored to actually be invited by Congressman Josh Riley a couple of weeks ago to Binghamton to present on sort of a remote congressional hearing on fentanyl and combating fentanyl in your community. It was really interesting. There were several police chiefs from like Binghamton, Vestal, what else is down there? Endicott. That were there, a couple of family members that had really been impacted and had experience with overdose, including one family member that had the loss of a loved one, and then, the public health perspective. And so it was great to really be able to share about the work that we're doing in Tompkins County, but also what we're seeing and the real impacts that we are still trying to combat around fentanyl. So that was kind of a fun event. There was some interesting news coverage on that as well. And then the last thing that I wanted to talk about, and there's also a handout on this in your packets. It looks colored, so thank you to Brad, wherever he is, for printing this out. It kind of looks like this. We have embarked on what we've sort of been calling a program realignment on the public health services side. We are taking a look at where our different programs fit and are nested together in order to better respond and meet community need. What this has looked like is sort of a staff involved and engaged process. We launched this in November. The first series included several meetings with our division directors kind of coming together. We also had a full half day that included any staff that might be impacted by these changes that were able to participate in sort of like a more extended focus group period to kind of get their feedback. And where we are at now is that I'm set here in the next couple of weeks, well, maybe even days, to sort of respond to staff with sort of a summary of the themes and concerns and opportunities that we've heard from them in the sessions that they were a part of, as well as some individual meetings with division directors to kind of discuss what some more granular opportunities look like. I have shared with all of our team, I've been part of reorgs where you were just told where to go and what to do. That doesn't feel good. It doesn't feel right. It's not the way that I want to lead this work. So I am really committed to making sure that staff have a voice and have able to be involved in this process and to contribute like what they know from their work and how that feels impactful to them. So we are going to be going through some additional rounds of feedback with staff for them to continue to contribute and shape to what this vision might look like. I think at its core, really, we are at a moment of inflection where public health, went through the merger with mental health, went through COVID, and then there wasn't really a moment to sort of take a look and say, in this new post-COVID world, where the landscape of public health has changed and the community needs in Tompkins County have changed, how are we best meeting all of those needs? And so the intent here is to really take a look at our programs and figure out if they can kind of be, where can there be force multipliers, where teams could come together differently or think about populations they're serving differently to better increase their impact out in the community. I've sort of said this, and this is in this Q&A. The Q&A that is here for you guys is also what we shared with staff as we started this process. Nobody is losing their jobs. I actually think this is a wonderful time to do this because we are not in a moment of scarcity here at the health department and in public health. So it gives us an opportunity with a full workforce to take a look at the impact we're having. So nobody's losing their job. Nobody's going to be asked to do dramatically different things. Our early intervention nurses are not going to be asked to become community health nurses, for example. But we will sort of be looking at the parameter of services that we give to the community and where we focus sort of our departmental attention on some of those things, and how people come together to make up teams and structures that can potentially have a greater impact for the work that they're doing. So that's happening internally at the moment. I'm anticipating at our next Board of Health meeting in January to come back to you all with a little bit more of a granular update on where we might be looking at shifts and what some of the opportunities are. I think we would also really love your feedback. You guys really represent a lot of our key community stakeholders, and you lead systems. So I think I am also interested in your professional experience as folks who lead and participate in public health systems, how you see programs in a way that could best meet your needs and how we could better partner across the board. And then my last thing is, this is not, it's hard to say this, and I hope that staff hear this and believe me, but it isn't necessarily a negative on this is all the ways we've been doing things wrong. It's really more of the landscape has changed and we need to think about changing with it. And that now is kind of the time to do that. Questions?
Yeah, I'm sort of curious why you took the position of nobody has to do anything differently. So especially given what it also sounds like is a recognition that the landscape has changed. There's different ways that we need to interact with the community.
Yeah.
So how are you and the staff sort of visualizing moving forward of just if all you're doing is just moving the chess pieces around, but not actually doing a deep dive into what's actually in those chess pieces? Does that still make sense?
Yep, that's a great question. So I think two things. We did get a lot of questions about this, and I know that there's staff in this room that haven't gotten us follow-up yet, but we are working on an additional internal FAQ to kind of further explain some of these pieces. I think for this one, it is that if you're a nurse in the early intervention program,
You're not doing huge dramatic shifts.
we're not going to say you need to become a community health service nurse. But it may be that if you're a community health service nurse, what's in your portfolio as a community health service nurse might shift. So maybe you've been doing 4 different programs before, still within your job scope, but instead we're going to say, we will chat and be where do you feel like you best fit? We're trying to sort of focus on this. Can you shift your focus from these 4 things to these 2 things? And I think, frankly, some of the deep dive on where we are putting our investments, it's hard to see right now because it is kind of scattered across this. So I think not now, but first we need to do the reorg to then be able to be okay, actually 80% of our staff time is focused on families in Tompkins County. Is that the direction? Is that where we think we should be having the most impact? Or are we really lacking on chronic disease work? And is that where we need to build out? And so it's hard to see that until we kind of shift things around. And I do think I see it as we hear a lot from staff about challenges around coordination, collaboration, and communication internally. And I think, I see this, and I hope that others see this too, as there have been a lot of internal ways to try to improve communication, collaboration, and coordination, but we actually just need to move around. And then there will be better communication and collaboration. And so I think it is kind of a force multiplier of like bringing people together who are doing like work and can then really increase their impact in what they're doing. That's a great, yeah, it's a great question.
I mean, I guess I would say I think this is probably really hard work, but I'm really glad that everybody is engaging in it. I know there's only a few staff here, but I mean, I guess I think this is the name of the game for every organization. I don't think public health is excluded from that. I mean, just from speaking from like an academic perspective, I think we're doing this exact same thing. And it's not easy and it's really hard. And it's a lot about, I think, sort of confronting how that landscape has changed and recognizing like we have to start to do things differently. And that doesn't make it any easier, even though like intellectually it's like, okay, we see it. So I guess I would just really commend everybody who's part of this, that's really doing things that probably are uncomfortable. And but I think it's really important and necessary for moving public health forward in the county. And I would hope that we could get to a point where we're actually like at the forefront and doing things that are unique and different and being able to, like Sam was at the conference, the public health conference with some of, I can't remember now what the work was, but like, it's great to see Tompkins County sort of represented that way of like, here's like new and different ways that we're sort of approaching things and being able to do difficult things anyways. So kudos. I know you got a ways to go probably, but it's great. That's from anyone else? Are you changing where you are? Is Cornell changing?
We change every day.
Great.
Not
Okay.
change for the sake of change.
Yes, exactly. Thank you. I won't even ask you because. Okay, yes.
Is this an internal?
I've been sharing it publicly, although I would love to get you a more updated 2025 version if it's something that you'd like to share.
Well, just a quick question. Have you considered, maybe you do this internally and it's provided the denominators for some of these items and
Yeah.
looking at that and how do we increase the percentage?
Yeah, it's a great question. I would love to see, we've talked about this, and this is all very hypothetical and resource based, but we've talked about a lot of counties have like their CHA chip on a dashboard where you can sort of see indicators changing and impact. And so I would love to be able to eventually build something out that also can reflect our data and our work over time in a way that shows impact as well. Yeah, but it's a good question. Like I have no idea how many restaurants, like I have no idea what percentage of restaurants, the number of food establishment inspections are, but it's also like some are repeat and yeah.
And some things I imagine are difficult, if not impossible, to have a data impact.
Yeah.
How do you measure your effectiveness? You know, your new vision, how do those line? Thank you.
And also publicly, Shannon did a great wrap up at the end of the year and used some of these in addition to other data points to kind of show the impact that we did have in 2025 that was on our Instagram and maybe elsewhere. I'm not quite sure, but Shannon did like a wonderful wrap up of the year.
I was so struck by the number of mental health visits.
That's crazy. It's
Yeah,
crazy.
it's so bad.
Yeah,
It's so many. I had no idea you all
Yeah.
have many, so. Okay. I think I've got myself out of order here because I started looking ahead. Wait. Have
anything to add? I mean, it's because it's November and December, it feels like there's a lot of stuff in here. So I guess, one area that I think we've done a lot in recently is oral health. And this might be a good focus topic for a meeting in the next few months, but our committee would like to explore a hygienist model that travels to schools and daycares in Hopkins County and sort of supported and funded by Whole Health. That's sort of a long range plan. We're also embarking on a performance incentive project through New York State DOH about fluoride varnish. So Dr. Kay and I and Sargika are reaching out to pediatricians, family practice, to, if they have not implemented fluoride varnish at well visits for ages 0 to 6, can we support you to do this? Here's some training, here's a presentation, here's how you do the billing, you know. So we're working on that. We've made contact with a lot of local offices and also with Payment Health Systems and Guthrie on that project. So I think that's kind of the highlights from CHS.
Great. Any questions?
Question.
Yeah.
I actually noticed it in Dr. Kirkpatrick's report about the tick-borne diseases moving away Lyme, moving away a little bit from Lyme to abesiosis and
Anaplasmosis.
Thank you.
Yes.
So I'm wondering, has there been communication to providers in the community that maybe this is what we might be seeing in spring, summer, fall, like winters?
To not just test for Lyme, but do something called a
Yeah.
tick panel where you test for all of them. I guess, Dr. K, do you put that in your bulletin? Maybe you guys are speak up about.
I think area practitioners are very, very aware. We've talked, it's been in my practitioner bulletin multiple times through the 2024, 25. Trends in these bulletins are not infrequently included in my practitioner bulletin. You know, I think they're hearing it from other venues as well. And as they see cases and hear cases, it becomes very, very much on their radar.
And Friday mornings, we have a conference at CMC every Friday, a CME conference. And this past year, this was one of the topics reviewed. Tick-borne illnesses, the infectious disease physician gave a thorough review of current state, diagnosis, treatment. And that's a topic that keeps coming back because every lecture we have a space to, what do you want to hear more about it? And this comes back up and again.
Very good. Obviously, it's pretty well known from a medical community here in Tompkins County, I think. We're all pretty much on the same page, I think. Yeah.
The elderly get really hard hit and they can be hospitalized.
Yeah.
Because it changes all the platelets in it, you know. It's out of whack.
Yeah. Okay. And you, okay. What?
Well, at least we had this winter at a legitimately cold winter.
Yeah.
Hopefully.
Better season next in the spring.
Yeah.
It'd be below, I can't remember the temperature cutoff, but it has to be below a certain temperature for like.
Pretty much around 34.
I think we nailed it.
But for a long time, so remarkably like.
Okay.
Sort of spring back to life. I don't know. Freaky.
Any other questions? Okay, Sam, I'm gonna go to you next.
I also wanted to harken us back to November, that in case you missed it, there are some linked some really nice photos from the ribbon cutting event too. And thank you to Shannon for really coordinating that event. And then another event she was instrumental in was the Healthcare Career Expo that happened for high school students that is hosted by Edmonton College. Thank you, Christina, and your team for being very involved with that. And it's right before Thanksgiving, and I think over like 300 high school students.
We had 380.
Attend. We had great staff turnout. Environmental health was there doing some demonstrations about water, and we had mental health clinicians there helping neighborhoods. So it was really a nice team effort. And I was there briefly. I was like, smooth event. So So thank you for those. And then our community health assessment and our draft community health improvement plan were submitted to New York State at the end of December. And the community health assessment is now up on the website. There's a nice landing page for it. And then we'll continue to break out some of the parts and the data that's included in the document because it's quite long to download it, but you can download sections of it. So that's available. And then we'll continue the next couple of months working on the improvement plan or work plan that really identifies the interventions and strategies that we'll be working on for the next several years. So that is in process. It will be connecting with a lot of the community partners who are involved with that work. And then we are having a couple of staffing changes. Just our health educator for Healthy Neighborhoods and Tobacco left to because she became a licensed nurse. And one of our community health workers also went on to pursue some higher education and planning. So it's also an opportunity for us to, think through what these positions will look like going forward. So we are doing that now and hope to post them. And then lastly, it is Radon Awareness Week. So we sent out a press release about that this morning and just a reminder about radon, that invisible odorless gas that that is still the leading cause of lung cancer in people who aren't smokers or don't use tobacco. And Tompkins County, if you look at a map of the state, along with Portland, which even has higher rates, but we fall into this red zone for the state of higher radon levels on average in homes. And so just reminders, it's really important for people to test their homes, that we looked it up again, and that the guidance or the recommendation is to test your home every 5 years. And is that if you have a mitigation system in your home, to test every 2 years. And I mean, yeah, people who have owned their homes for a really long time, I'm sure not, they test initially, but maybe don't continue. So there are tests available pretty cheaply through New York State, actually, that you can order, and it's a full kit that comes to your home. And then they're available at all the big box stores too. And then folks who are interested in Healthy Neighborhoods visit, we also purchase and receive kits from the state that we can help people set up and better understand. So yeah, it's really important to not forget.
And we have someone on staff who's very passionate about radon. So if anyone has any questions or wants to dive in more, I'm sure she would love to talk about it because she's really passionate about it. So it's great. Diana Crouch, she leads our Healthy Neighborhoods program. She went to a radon conference, or is going this year. Or when?
She went to a national radon conference. Yeah, earlier this fall, or in the fall. So yeah, there's a lot of interest, and it's an issue in our area. So it's like Sandy. Any questions? Yes.
Yes, along the radon, I was told that on the western side of the lake, there's less. Is that correct?
I don't know.
I don't know offhand either.
I'll have to look at the map.
Yeah.
Is that where you live in?
That's the thing is, we were told that it's not a big problem in this area on the west side of the lake, and I was just wondering. Yeah, I guess it was somebody who was doing the home test initially for us.
It's change, based on sort of the composition.
So west side of the lake, and we have radon mitigation in the home.
Oh,
So N of 1.
okay. That's important to know.
We last graph on our website that shows that possibly there's some statistical truth in that. It's looking like Ulysses and Enfield that are on the west side of the lake are at a 30%, whereas like other areas, Groton, Dryden, Caroline, Newfield are higher. So Ithaca falling in the middle. So
Maybe.
Interesting.
But
Yeah.
don't be false.
No. Sounds like basal testing is good.
And
Do you have?
and then we actually just recently, we can request from the state, sort of we can request like the data from the tests that we submit throughout the neighborhoods too. So we were just gonna take a look at that. But we'll continue to have this information that's on the website.
Other questions? We're right on our hands.
I didn't realize that. Honestly, we tested when we first moved in 15 years ago. Ruh-roh.
So.
But I wrote it on my hands.
We wrote it on our hand. Another N of one that you've saved. Okay, Jessica's not here. No, she's gonna make it. So
As good physician, you should be washing your hands, so that'll disappear.
Skip, do you have anything to add to your report?
I don't have any new items to add other than what's in this month's.
Okay, anybody have any questions for Skip on his report? Alrighty, if we have, I think that's that we have satisfied all agenda items. Yes.
Question for Jeannie. So when we had the tobacco vaping deep dive.
Yeah.
Whatever, it was, September, October. Is there any plan to go up 6 months, a year, whatever frequency makes sense from your perspective to update what you guys will be doing?
Yeah.
The deep dive.
Yeah, absolutely. So one of the positions that Sam is looking to fill is this youth tobacco education role. And we are hopeful I'm not sure yet the certainty with which I should make this statement. I'm gonna fund that role. Used to be half-time healthy neighborhoods and half-time tobacco, and we're looking to make it full-time tobacco with some dual funding. So that is an interesting opportunity that can hopefully help us advance some of these things. And then Skip and I have it on our very lengthy ever-growing to-do list to kind of talk more about local laws that are happening, but there's also opportunities for things to move through Albany. So all to say, yes, we'd be happy to come back with an update. I think we were sort of stalled on new person, new legislature coming on board, and then wanting to see what happens statewide before we propose any additional changes or anything here at the county level.
Thank you. Is that something you would do with other deep dives that we be coming?
Yeah, that's a good question. We should think about it. I mean, I think we've been trying to figure out how to give you all like a better, more interesting and engaging slice of the work that we do. So like trying to come, like when Sam's gonna bring the chat chip and actually ask for some meaningful feedback on our interventions. Same with Ryan kind of coming to get like more meaningful feedback on our preparedness work. So we can think about how to sort of work in like an update schedule, especially for the ones that are more not just one time, like please tell us what you think about this and then we'll just submit it. Yeah, definitely. And we're open to feedback and ideas on other structures or other ways you guys would like to be engaged or get some of this other information. It isn't just the routine updates.
No, I think I like the concept of the deep dive.
Okay.
I do.
Any other comments, questions? Right, we've completed our agenda, so we'll go ahead and adjourn and we will see everybody on February.
So now we'll be here in February.
No, wait a minute. That's 24th. February 24th. You're not gonna be here that day? Okay.
I'll be in Italy.
Thanks.
Well, so you could tune in, but I'll be.
No, yeah.
6 o'clock.
Time.
All right, everybody have a good
Power
one.
of peace.
Usually when I.
Where is the AP then? Monday, Senator Rivera. who's like the House-
This is the most.
We did the amount because it's scary when you're.
Yeah.
Crazy standing driver.
And you're.
I